Hello, my YouTube family. This is Dr. Lee, and I'm coming back with you with another one of my videos. Today, I will be working with Pearson VUE. Some people call it Credentia, with their skills, and we're going to be looking at skill number 19 that deals with providing foot care to 1 foot. Okay, and in this book, there are 17 steps for foot care. So with that, I'm going to go ahead on and demonstrate the skill, and then we'll talk about it afterwards. Turn the camera a little bit so you can see the mannequin full force. Okay, here we go. Good morning, Miss Mary. How are you doing? My name is Dr. Lee. I'm going to be your CNA for today, and I'm here to provide foot care on you for 1 foot. Is that okay? Okay, great. So I already know that your bed is in the low position and the wheels are locked. I'm going to pull the curtain to provide for privacy. I'm going to go wash my hands, and now with my clean hands, I'll get my clean supplies. I need at least 2 large towels, 2 small towels, a pair of gloves, a bath basin, lotion, and soap. That's going to be the minimum for my supplies. So I'll go and get that. The supplies on test day will be laid either around on a table, a counter in that testing room, or on some shelves. Okay, so I'm going to go pick up my supplies. So I got them here. So I have 2 large towels, 2 small towels, pair of gloves, lotion, and soap. Okay, so I'm going to come over to the sink area, and I'm going to get a paper towel to turn my water on. When I turn the water on at the sink, the sink handles are dirty, so I want to turn it on with a paper towel because my hands are clean. Okay, and I'll put these in the trash. I need to test the water to make sure that it's comfortable, and I'm also going to have the patient test the water. When you put water into the basin, you want to put at least a half a basin full of water. That's kind of like the minimum because the foot has to be immersed into the water. So I'm testing the water. I can say the water feels comfortable to me. I'm going to let it run. I'm getting a paper towel to dry my hands with. And I threw that paper towel in the trash that I dried my hands with. Okay, now I need to turn the water off. I'm going to turn the water off again with a clean paper towel. All right, and that will go into the trash. I'm going to bring this water back over to the table, and I personally like to get an extra paper towel. You don't have to. This extra paper towel is for the patient to dry their hands with when I come back over to the bedside. So now that I'm back, I'm going to say, Miss Mary, I'm here. Can I get you to test the water so that we can make sure that it's comfortable for you? So I'm going to come over to the side, and this will be done on a live person, not a mannequin, on a live person. So I'm going to come over, I bring the water over, I'm going to say, Miss Mary, can you test the water? Is that comfortable for you? Okay, great. I brought a paper towel here for you to dry your hands with. Again, bringing the paper towel over for the your patient to dry their hands with is not a requirement for the test. I just personally bring an extra paper towel over because I've learned when I worked in the hospitals or nursing homes, when they test the water, if you don't give them something to dry their hands with, they either dry it on their clothes or they dry it on their sheets. So I just bring over an extra towel. Okay, now I'm getting ready to do the foot care. The state requires that we put a barrier down before we put the basin on top of it. So I'm going to say to my patient, can you please raise your leg up so that I can put this barrier up under one leg, and I'm only uncovering one leg. I'm going to put the barrier down. This is doing it in the bed, and I prefer the bed because I don't have to do all this bending if they're sitting in a chair. Okay, so now that I have the leg on a barrier, I will say to my patient, can you bend your leg? Okay, so I would get my person to bend their legs. Once they bend their leg, I want to make sure it's comfortable for them. Miss Mary, is that comfortable for you with your leg bent? Yes. Okay, now I'm going to bring my basin over. She's already tested the water. And I'm going to say, Miss Mary, I'm going to put my gloves on, because we have to have gloves on before we start washing you. Okay. I'm going to go ahead and put my dry towel in the bed. So I put my 2 washcloths in the bed. I'm going to support the leg, and I kind of support with her leg laying on this part of my hand. Support the leg, and then Miss Mary, I'm going to be putting your foot into the water. So you want to immerse the foot in the water. Okay, so the patient is in bed, the foot is in the water. Now I'm going to wet the foot with one of the towels, and then I'm going to wring the water out. And remember, we put soap on a wet washcloth. So I brought soap. I'm going to get my soap and put it on the washcloth. All right? I'm going to massage it in. Do not put soap in the bucket of water, because you're going to use that water to rinse the foot off with. I'm going to cover the patient's whole foot with this towel so I don't have to do a lot of the flipping. All right, so I'm going to get my towel real soapy. Again, I'm going to support the leg with my forearm here, and I'm going to lift it out of the water. It's over the basin and over the towel that's on the bed. I'm going to cover the whole foot up with the towel. And now I can wash. And I'm only washing the what? Foot. And I'm going to go between each toe and toenail. Each toe and toenail. And then just rub this all around the foot. And make sure that you are supporting the foot. Okay, hopefully y'all can see that I have suds on there. Maybe you can zoom in a little bit to see that I have suds on. This towel I'm just going to set over to the side. I'm going to put the foot back into the water and rinse the soap off. That's good for rinsing. I can rinse it over the basin. All right. Now I am through with this basin. I'm going to move it out the way. I'm going to get my dry towel. I'm still supporting the leg. I'm going to cover the whole leg up. Okay, Miss Mary, let's go ahead on and let your leg down. I'm going to move this basin out the way so that we don't spill water. And I'm going to dry your whole foot with this towel. And I'm going to dry between the webs of the toes, toenails. Just get the whole foot dry. Okay. You can see the foot is dry. Once I have the foot dry, Credential requires for me to put lotion on the patient. And I need to warm the lotion before I put it on the patient. There are a couple of ways that we can warm lotion. One way, I could have brought an extra basin of water, put warm water in it, and put the bottle in that warm water and let it be soaking while I'm doing the foot care. That's one way. The second way to warm the lotion is to put the lotion in my hand, squirt it, okay? Then I'm going to rub my hands together. This is the second way to warm the lotion. When I put the lotion on the resident's feet, I only put it on the top and the bottom. That's it. Do not massage it between the webs of the toes. So Miss Mary, I'm going to raise your leg up again. I'll support it with my arm. I'm going to go up the bottom and on top. That's it. Bottom and top. If you felt like you put too much lotion in your hand and it's on your partner's foot, you can always dab it like that to remove the excess lotion. Now I'm through with that part. Miss Mary, I'm going to support your leg. Take this towel back. We're going to cover you back up. And then I'll come back and give you your call light and open up your curtain. So now it's time for me to put everything away. My towels, I'm going to go ahead and put into the dry linen container. My wet towels, I'm going to squeeze the water out of these, and I'll put the wet ones, into the wet linen container. I want you to see what I'm doing here. I'm going to turn the camera a little bit so you can see the sink area here. Okay, so I have the water that I use for washing the foot with. I'm going to empty the basin. I'm going to rinse the basin, and I can take my hand, my gloved hand, and turn the water on. I'm going to pour the rinse water down the sink. And then I'm going to dry the basin. Okay, all of this with my gloved hand. Now, there is an area that will be a sign somewhere in your testing area that will say dirty supply, designated dirty supply area. Wherever that sign is at, that's where you want to put your basin, your soap, and your lotion. Just leave it in that designated dirty supply area. Now that I've put up all of my dirty things, I can take my gloves off. And if you haven't gotten into the habit of pinching in the center, get into that habit, because you may have to do it if you have PPE. But I know this skill is not about PPE. But I'm going to pinch in the center to pull my gloves off, ball it up in one hand, come under the bottom of the opposite hand, and pull that off. Okay, so I'm going to take my gloves off, wash my hands. Now that my hands are clean, I'm going to go back to my patient and kind of wind things up. Okay, Miss Mary, my hands are clean now. I want to give you your call light. You can push this button if you need to get a hold of me. I'll put it right here by your hand. All right. Is there anything you need for me to do for you before I go? You're good? Okay, great. I'm going to open your curtain. And then I will look at the evaluator and say, I am through with my skill. All right, so now let's sit down and let's talk about skill number 19 in this book. So steps 1, explain the procedure to the patient, maintaining face contact, which is what we did in the beginning. I came in and I said, good morning, Miss Mary, I'm here to do XYZ. Step 2, privacy is provided with a curtain, screen, or door. I knocked on the door and closed the door when I came in, but I also pulled the privacy curtain. Step 3, before washing, checks water temperature for safety and comfort, and asks the patient to check the water temperature. So when I was at the sink, putting water in the basin, I checked the water temperature with one hand, and I had the patient check the water temperature. Now, sometimes I have students say, well, does it matter if I have gloves on when I check the water temperature, or do I have to check it with my bare hands? As far as credential is concerned, it does not matter if you have gloves on or not. Number 4, basin is in a comfortable position for the client and on a protective barrier. So when I came to the patient's bedside, I said, Miss Mary, can I have you bend your leg? Is this position comfortable for you? And then the patient said, yes, I put a towel under the patient's foot. So you have to make sure that it is comfortable for your patient, okay? Because the patient may have arthritis in their knees, and maybe they need a knee replacement or something. If you're gonna do it in the bed, make sure you ask your person, is this position comfortable? Puts on clean gloves before washing, and I did that before I even started getting soap and water. I got clean gloves on. Number 6, place the client's bare foot into the water. This is why in the beginning I said make sure you have at least a half a basin full of water so that you can put the foot into the water. Number 7, apply soap to a wet washcloth. So we wringed out our washcloth, I put it over to the side, squirted some soap on it, got it real thick, and then came over. Number 8, I lifted her foot out of the water and started washing the whole foot and toes. I did not wash it while it was in the water. I supported the leg and lifted it up and then washed the person's foot, all right? Let's turn the page and go to number 9. Rinse the foot, including between the toes. Now, this is where sometimes students have a problem. They'll say, well, Dr. Lee, you rinse the foot in the water. That's okay. It didn't say you cannot keep the foot in the water while you're rinsing. It just said to do what? Rinse the foot. Get all the soap off of the foot. So if you want to leave it in the water and rinse it that way, you want to bring it up and put water on it, I don't care. For testing purposes, the only thing I want you to do is to get that soap off of the foot. Number 10, dries the foot, including between the toes, with a dry cloth or washcloth. So I had another towel here, I took it and I dried the foot. Number 11, applies lotion to the top and bottom of the foot, excluding between the toes. When I go to put the lotion on, it's only on the top of the foot and the bottom of the foot. That's it, nowhere else. If you put it between the toes, that can hurt you when you test. The reason that we don't put lotion between the webs of the toes is that it makes the skin soft between the webs, and it can cause little openings, cracks in the skin. And if the person is diabetic, it can be hard for that person to heal with openings in the feet, okay? So we don't put lotion between the toes. Okay, number 12, support foot and ankle during the procedure. So I have to make sure that I am supporting the leg. The person is just not holding the leg up the whole time. 13, empty, rinse, and dry basin, which is what we did. 14, place basin in designated dirty supply area. I showed you the sign that I have here at my school. Wherever you test that, look for that sign. And it's normally a pink color sign, but just look for that sign. 15, dispose of linen into soiled linen container. There'll be some type of dirty clothes hamper for you to put things in. 16, remove gloves and without contaminating self and into the container. When you remove your glove, you wash your hands, and then I made sure that the patient had the signal device on. All right, so hopefully this helped you with doing foot care. Then this is skill number 19, provides foot care on one foot. So again, I did it laying with the person laying in bed because it's easier for me. If you all want to see a video of the person sitting in a chair, I'm not going to get on the floor, but I'll sit in the chair next to the patient and I can do it that way. But for me, it's easier just to do it with the patient in the bed for testing purposes. And I just do it in the bed. But if you want to see a video with the patient sitting in the chair, leave a comment down below, and then I'll see if I can get that video for you. Okay, so once again, my name is Dr. Lee. If you have any questions whatsoever, any comments, I do respond to comments, just put it down below, and I will see you, all right, in the next video. Take care.